Thank you, Mark, and thank all three of the speakers in this session, Claire, Stephanie, and Mark. We're running a bit over time, but that's because a lot of really good information was presented. So I'm going to monitor the Q&A panel. And one question that came up by several people for Claire was to explain the State Department leak test a bit more.
Okay, so basically we're using either Vitrex or irritant smoke if it's a N99 respirator. But we offer the people the choice of challenge agent. We have them show up, preferably wearing their respirator. And so we just do a quick puff, and that's typically all it's taken to show that the respirators were leaking.
Thanks, Claire. Mm-hmm. And I'll take myself a question that came up. With regard to wildfire smoke, are we just worried about the fine particulate? What about the gases? And as Joe Dimitrovich said in the last session, the wildland firefighters have to worry about gas exposure, but downwind, like San Francisco was 175 miles downwind from the Camp Fire in November 2018. It was all about wildfire PM 2.5 and not about the gases. Okay, so one question is the public will not deal with fit testing unless it is paid for by the municipality. I think even if it's paid for, they might not deal with fit testing. And this person also said there should be a central stock at the local level to allow public citizens access. I certainly agree with Mark's comment about we need to increase the production of N95s and possibly surgical/medical masks so that they're available for the public as opposed to just for frontline workers. Here's a question for any of the panelists. How about the issue of using medical tape to secure a disposable mask to get a better fit and reduce leakage? Somebody want to take that one on?
Sure, I can jump into that. So, anything you can do to improve the fit is going to be helpful. I think the problem comes in if you don't know what the filtration characteristics of the material of the mask are, then you're sort of still in the area where it gets difficult to predict, right? So securing something like an N95 or a surgical mask where you have a better sense of what the filtration properties are is probably going to decrease your exposure. Doing that with a cloth mask, again, becomes really hard to predict because I can't tell you what the filtration characteristics of the cloth are. But I think the other thing to consider is that anytime you're doing something that's going to potentially irritate your skin, it's hard to do that for long periods of time, right? So, I'm sure you've all seen the pictures of healthcare workers coming out recently who just from wearing an N95 on their face with the pressure day after day is causing some skin breakdown. I think we really need solutions that fit better for the general public without having to do these sort of extra ad hoc kinds of measures.
So, Mark, I'm going to direct the next question to you. There have been actually several questions about N95s with exhalation valves. Do those provide adequate protection?
Well, for the wearer as respiratory protection, the exhalation valve's not supposed to leak. There always probably is a little leakage, but during the NIOSH approval testing, the exhalation valve leakage is assessed and it can't be above a certain level. So I think the issue is the N95 as a source control for reducing the amount of virus exhaled by an infected wearer. That's how I've heard the issue arise. So there hasn't been really any quantitative testing that I'm aware of the amount of air, unfiltered air that comes out of an N95 with an exhalation valve versus what comes out through the actual filter material or around the mask perimeter. You can think of three different pathways out, okay, which is sort of like the three pathways in. You can have unfiltered air come around the edges of the mask. You can have filtered air come through the mask media itself, and you can have unfiltered air coming out the exhalation valve. And I haven't seen any studies that have apportioned the percent of air or volume of air coming out those pathways. I suspect that a limited observation that was made during a NIOSH study was that the exhalation valve during light exercise, during a fit test, on an N95 did not look to be activated, visually when people were doing their light exercises. So that suggested that there's not a lot of air coming out through the exhalation valve, that you actually have to build up a good amount of force for the exhalation valve to be activated such that air comes out of it. Just my impression is that I don't think that the amount of air coming out of an exhalation valve on an N95 respirator is of a filtering face piece N95 respirator is any kind of game changer in not wearing the device, that it's not protective. But if that's a source of concern, then you shouldn't use an N95 filtering face piece with an exhalation valve.
Thank you.
Or you can try and cover the exhalation valve with some surgical mask material. And then you can filter the air. You make your own ad hoc sort of respirator. For the general public, it doesn't matter because these masks, this is not regulated or approved usage. There could be someone might look askance at it in a workplace setting.
So Stephanie, this one's for you. So there's one question about ear loop KN95s that are widely available. Do you think these are efficient enough, or do they offer a false sense of security?
Great question. I think it's hard to know, right? So we know best when things are regulated. So a NIOSH certified device, I am confident in recommending for somebody. Things that are coming in to this country through unusual routes, including, I know a lot of people just ordering things online and getting devices from all over the place. It's hard to know what that certification means. In theory, the KN95 certification standard is a good standard. But again, at this point, we've got things coming into this country from sort of a bunch of atypical pathways. And so it makes it much harder to know what level of protection people are getting.
Thank you. Claire, one of our audience asked about the fit of non-fit tested respirators and suggest that one solution may be the use of frames that are set over mask to enhance seal to the face. Have you encountered use of frames at all with State Department employees?
Haven't run into them at all. I'm curious. We are partial to elastomeric face pieces, find a better fit with them. But no, I'd be game to try them if it works. And just to follow on to the last question, with the ear loops on the air pollution masks, I have seen some models that have a strap that connects the two ear loops. And I'm curious to see how much better that works.
Well, I will just say that for just walking around my neighborhood in terms of COVID-19 here in Berkeley, I have one of those, mask extenders for ear loop cloth mask, and it definitely makes the fit better and it's more comfortable. So, Mark, there was a question specifically for you about your call for increasing production of N95, which I also endorsed. This person says the N95 requires fit testing to be effective. Will wearing an N95 by an individual who has not been fit tested give a false sense of security and reduce social distancing?
It only gives a false sense of security if you don't understand what the limitations of the device are. So it goes along with communication of information about the capabilities of the device that you're wearing. So a non-fit tested N95. Stephanie had presented some NIOSH data, which is lab testing, on the ability of non-fit tested N95s to reduce exposure. The limitation of the NIOSH lab testing, of course, is it's lab testing, and therefore people are wearing it, maybe doing more active activity, and so the respirator is subject maybe to more stress. But this is very old data. I would say that a non-fit tested N95 filtering face-use respirator would reduce exposure somewhere in the neighborhood of 75%. Okay, and if we're using the current criterion of better than nothing, that's certainly better than nothing. So yes, I think the N95 filtering face-use respirator would be a benefit. Is it great? Is reducing exposure by 95%, 99%? No, but 75% reduction, I think, to me is significant.
And Stephanie, there was a question about the 3-layer cloth mask that CDC at least was recommending. I don't know if they currently are. Could you sort of address how good those are or aren't?
Yeah, it's a great question. I can't really address it because there just isn't any data. So I wish I had information to share. As I said, the limited number of studies that have been done assessing different types of cloth masks have suggested that filtration characteristics of the fabric are very variable. And so without knowing a lot of specifics about a fabric that's being used, it's just nearly impossible to predict how much protection someone's getting.
I guess the other thing I would add to that correct answer is, the more layers, probably is the operative term, the better filtration, but also the increased resistance to breathing in terms of comfort. Okay. So, see. Any further comments from any of our panelists about the KN95s that are widely used in China and are at least made to a standard that's used by the Chinese government?
John, this is Melissa. Marianne D'Alessandro typed in something. Marianne, do you want to say what you typed, or would you like me to read it?
Sure. This is Marianne. I can just mention that NIOSH has evaluated a lot of the KN95s, and we have found that about half of them have not met the requirements to the standard they purport to meet. And FDA has an emergency use authorization for KN95s that identifies those KN95s that do perform to filtration efficiency requirements similar to NIOSH requirements for use in healthcare settings. So that's, you can go to our website in the respirator assessments that have been done for the COVID-19 response. Thanks.
Thank you, Marianne. That was really helpful.
This is Mark. Just given the fact that the KN95s I have seen have all been with ear loops, I would just believe that, and I don't believe they've been quantitatively fit tested, at least I haven't seen any data on that. I would expect them to have more face perimeter leakage than would a NIOSH approved N95 filtering face-use respirator. How much greater, that would need testing. But, I don't think that they are the equivalent of what the NIOSH approved N95s are.
And Marianne, while we have you, could you also comment about the difference between a NIOSH approved N95 and an N95 that a manufacturer puts out?
So a NIOSH approved N95, you mean versus an N95 that is approved or has been evaluated to standards in other countries. So is that what you're asking?
Well, I think I understood from a previous discussion, Marianne, that, people can use the N95 moniker even if it hasn't been NIOSH approved because, NIOSH doesn't have copyright rights at this point.
Oh, yes. Thank you. Okay. So the N95 term is a term that has no regulation associated with it. So we are in the process of trademarking that term, but at this point in time, there is no trademark on that term. So if you're looking for a product to meet the requirements of a NIOSH-approved N95 that has the filtration requirements and breathing resistance that we require, then just looking for that term N95 is going to be probably meaningless.
Thank you, Marianne.
Mm-hmm.
So a comment that doesn't really need an answer from the panel, but I think it's important. We've touched on it, but with COVID-19, you really need to know the infectious dose of the virus and really what size particles we need to protect from. And so until we have better data that are universally accepted, we actually have a problem with regard to both source control and protecting the public. I want to make sure that other members of the workshop panel, moderators, planners, has a chance to weigh in. So please, jump in if any of the panelists and the wider workshop group have things to say.
Hi, this is Rich Metzler. A couple of years ago, I had the opportunity to look into the Chinese GB 2626 standard and was able to research that it essentially was a combination of European standards and NIOSH standards. It was an excellent standard. The data that Marianne presented would have you think that there may be an issue with the conformity assessment program, right? Or there may be some counterfeiting or mislabeling, inappropriate labeling by the folks who are distributing those respirators.
Thank you, Rich.
John?
No, go ahead.
Okay. In healthcare, KN95s have been seen in many healthcare facilities on the East Coast in New York State and New Jersey. And the reports that we get from the safety and health representatives and staff from the healthcare unions is that these have been handed out, but there's been no fit testing. And we all know that, those devices with ear loops generally are not going to provide an appropriate fit and pass the fit testing requirements, but they're not even doing the fit testing whatsoever.
Thanks, Bill.
One thing that would be useful is, and there was a little bit of data collected, is how well a seal check by itself will suggest how well a respirator would fit somebody with a positive seal check. Back in the H1N1 influenza pandemic, FDA had a requirement if you wanted to market respirators for influenza to the public, you had to do a study. And the study involved having an anthropometric balanced group of people who had never worn a respirator before, read the instructions, perform a seal check, and then be quantitative fit tested. I had the opportunity to do it for one manufacturer, and their respirator failed miserably. But it was my understanding that 3M also did that, and they in fact passed that. Marianne may know something about it, but it seems to me that it would be very interesting to know and to encourage respirator design so that a user seal check gave you a pretty high reliance that the respirator, if it passed the seal check, would actually provide a useful fit. And that could eliminate some technology, particularly to the general public, if you had that kind of data and that kind of procedure. I don't know if anyone wants to, Mark or anyone else wants to comment on that.
I'd be really interested to see what that 2009 data was in general. If manufacturers actually went through the exercise of looking at the effectiveness of a seal check followed by quantitative fit testing. The only 3M study, and maybe 3M did that in 2009 as well, but the only 3M study I'm aware of is something that was published in the mid-90s. And I have to say that the study authors this is getting into the weeds of fit testing, but they used a pass fit factor of 10 on their quantitative fit testing to say that it was a good fit, as opposed to the standard in OSHA, which uses a criterion of 100, a much better fit in a quantitative fit test. So the seal check looked okay if you used a lesser criterion for what was adequate. But I'd like to see actually what came about during the H1N1, because that could be very valuable.
Jim Johnson, I know in looking at the ear loop issue, which is certainly one, there has been some preliminary data that shows that if you get the right kind of fit on the ear loop, you'll get anywhere from 6 to 10 on a measured fit factor with that. So there is a little data out there that indicates there's some kind of fit, but it certainly doesn't come up to the strap requirement of 100 to get the OSHA approval.
Thank you, Jim.
John, this is Bob Harrison. I have a question.
I was waiting for you, sir.
Okay. Are there any laws that prohibit the sale of counterfeit respirators in the United States? Is there a role for the FDA, Consumer Product Safety Commission, or any other regulatory agencies?
Excellent question. I don't know if Rich or Marianne could comment on that.
I could share an
Yes,
experience.
this is Marianne. Let me share what's going on now. So with the COVID-19 response, what is going on now is you do have every federal agency involved, the FDA's Criminal Investigations Division, the FBI, Department of Homeland Security, all are involved in looking at these issues and trying to get these products off the market. So there is a rule right now. There are rules across many federal agencies.
Thanks, Marianne.
Mm-hmm.
Rich, do you have anything else to add?
No, I was going to say that years ago we had an issue where we contacted the FBI and the State Department concerning a non-conforming product that we wanted action taken to have the supplier stop the false declarations. The issue wasn't big enough for them to have an interest in it. So there wasn't really a requirement that it needed to be followed up on. I guess today's problem is bigger, and they're looking into it.
So we've run out of time for this session. So I just want to thank again our speakers, Claire, Stephanie, and Mark, for doing a really excellent job. And one last note, several people from the audience brought up the issue of the psychology of wearing respiratory protective gear. And I think we're going to get to that later in the program. So, Melissa, I'll turn it back to you.
So, colleagues, we're going to take a 15-minute break and then come back, and we're going to have a wrap-up of what we heard today with some of our session chairs kind of giving key messages. And then I think we'll all have a chance to meditate on what I think was really terrific and rich input all day today. So take 15 and come right back. Thanks, everybody.